So hi, all of you. Welcome to the Bachelor of Science in Nursing information session. Again, I apologize to those of you who weren't able to get in right away and to those who had to do some detective work to try and find the password to get in. We should have made that much simpler. I don't know what happened with the link there, but we'll have to look into that for next time around. Again, this is the Bachelor of Science in Nursing information session from BCIT. My name is Erin, and I am one of the marketing coordinators for School of Health Sciences at BCIT. So I do marketing and student recruitment. And our presentation tonight is going to be given by Jill Kerrigan, our program head, and then by Ambreen Sharif, our program advisor. So I'm going to continue on and let you know that the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of the Squamish, Tsleil-Waututh, and Musqueam. So our agenda this evening is the welcome and introductions, which I'm doing right now. We're going to have a presentation and program overview from Jill Kerrigan, our BSN program head. And then our program advisor, Ambreen Sharif, will come on and speak a bit about how you apply for the program, how you work towards getting accepted. And then we will have some time at the end for a Q&A. Now, as we go along, you will notice there is a Q&A function either at the bottom or top of your screen, depending on how you've got set it up on your end. And we'd urge you to pop your questions in there. So any questions you have, pop them into the Q&A. We'll try to answer some of them as we go along, and some of them we'll save towards the end, and we'll be able to answer those out loud. But if you are asking a question and then a follow-up question based on something we said back to you, please do reference the first part, because we can't really track who says what in that Q&A, so it can get a bit muddled if there's follow-up questions. So be sure to reference what you said before. Again, the Q&A function is open. We do have a Bachelor of Science in Nursing video.
Hi, I'm back to check on your blood glucose levels. Being in the clinical setting really puts my skills into practice. I love that I get to apply what I learned right into the clinical setting with actual patients. Clinical experience really consolidates what we learn in terms of knowledge in our theory courses. So I chose BCIT nursing because of the reputation it's built within the healthcare practice. And I wanted to show you about my patient. Right? I love that I get to collaborate with my student nurses and really get the hands-on experience that you normally wouldn't get at other institutions.
Okay, very good. Now make sure that you put that cup on.
The BCIT BSN program is a 3-year program where we give students the training and experience to practice as registered nurses across BC.
The patient's pupils and look quite...
From the very beginning of our program, students will get hands-on experience in the lab and in the simulation room.
Excellent, good placement.
This is really beneficial for students as it provides students with a safe environment to practice newly learned skills before applying it to patients in the practice setting. We are very excited here at BCIT to offer a brand new curriculum that was written in-house where students learn concepts that they will be able to apply to different contexts. Rather than learning just about diabetes, they learn about the concepts around diabetes and are able to apply it.
You can see there that it's...
When our students graduate, they are 100% prepared to practice in acute care settings, in clinics, and other healthcare settings across the province. Our grads are highly sought after by our health authority partners. There is ample opportunity for them to explore whatever avenue they choose.
The best thing about my clinical experience so far is how approachable and how really caring my instructors are. They really make sure that not only are we comfortable in what we're doing, but that the patients are safe under our care as well.
As I mentioned, Jill Kerrigan will be our presenter this evening, but before Jill comes on, or as Jill comes on, I'd like to do a few quick polls with you guys. So the first one is, how many nurses are there in the province of BC? And then the second question, of course, is which post-secondary in BC graduates the most nurses each year? Now I'm going to end the poll and I'm going to share the results. And Jill, do you want to tell us how right we are or how wrong we are?
Yeah, absolutely. Thanks, Erin. For the first question, the right answer is it's around 35,000. So 20% of you did get that right. So a little bit more than what a lot of you have actually put on your responses, but we're really happy that you guys got the second one right. BCIT does have taken the most nursing students, so we graduate the most greatest amount of nursing grads. So excellent response for that question. Okay, so thanks, Erin. Hi and welcome everyone. As Erin had said, thanks for sticking around for this session. It's great to have so many of you come tonight because we really want to have more nurses in BC, and it's a great start to see so many of you interested in the program. So my goal tonight is to give you a little bit of information about the program so that you can make some informed choices for yourself, whether this is a good fit for you and whether nursing's for you and whether BCIT is for you. And we hope the answer is yes to both of those. So what is a Bachelor of Science in Nursing? So to start with, here's some quick facts about the BCIT Bachelor of Science in Nursing program. It is a 3-year program. There's 3 terms. Each year has each term for a total of 9 terms. So it's offered over 3 years, like I said. You do still get most of July and all of August off, and the terms are 12 weeks in length. It's offered only on a full-time basis, and there's a mix of clinical, lab, simulation, and theory in each term. We offer a variety of clinical experiences from community, home care to hospital placements. The clinical starts in term 1 and it gradually progresses each term. And what's unique about BCIT is that we partner with the specialty program on campus. So you can take 2 elective courses in a specialty that's of interest to you near the end of the program. And you do graduate with a bachelor's degree, and you can begin working as an RN upon completion of the entrance exam when you're finished. Simulation at BCIT. So BCIT has a brand new health sciences center, and in that building we have the largest simulation center in all of Western Canada, so that's pretty exciting. We have rooms that look like a hospital. We have high-tech robotic mannequins that have a heart rate, they breathe, they can even speak certain phrases, and students use the simulation space with an instructor to practice clinical scenarios so that they feel more confident in the clinical setting. So this building is new for us. We've had simulation in our program for a while. It's just expanded, and it's a great opportunity to really practice your skills so that you can feel more comfortable in the hospital setting. So what does a BCIT nursing grad look like? We base our curriculum on 7 attributes that we expect our nursing grads to have when they graduate. The first one is professional. So nursing is a regulated profession, so students are held to a certain standard and are expected to act in a professional manner. The second one is leader. Our grads can take charge of situations in order to plan care for clients. They're advocates, so they advocate for patients to ensure they're receiving quality nursing care. Collaborator, they can work with other members of the healthcare team in a respectful manner. That's why in our program we have quite a bit of group work. Global citizen, our grads advocate for change to address social justice and issues with healthcare equity. Lifelong learner, our grads are committed to lifelong learning so that their practice is updated and they stay current with their skills through self-directed learning. And lastly, communicator. We teach our grads to communicate with empathy, with compassion, and in an assertive manner with clients and with the healthcare team. So what makes a successful nursing student for BCIT? The students that we see that exceed in our program are students that are able to manage stress and anxiety effectively. They have resilience, they're able to overcome obstacles, and they have a growth mindset. This has really been shown to be the most helpful with nursing in general. Students should be effective communicators, fluent in written and in spoken English. This is a safety piece because nurses need to be able to communicate with clients, with families, and with other healthcare team members to ensure safe nursing care. If you have related work or volunteer experience, especially in hospital, in a care home, maybe lifeguarding or leadership in sports, it's not mandatory, but it might help you take on the leadership role as a nurse. Math and science, basics are required, not complex math equations, but nurses do need to use math to safely administer medications. Career outlook. So nursing is both a challenging and a rewarding career. I've certainly had no regrets going into the nursing profession. There's job security. There's the ability to gain employment as soon as you graduate. In fact, in BC, we currently have about 5,000 shortages for nurses. So definitely lots of opportunities out there. BSN degree will allow you to work globally as a nurse. And as I said previously, BCIT is in a fantastic position to offer students in the program a variety of specialty areas, because BCIT is the only one in the province who has those specialty programs in the Lower Mainland. So you will have an opportunity to, I'll talk about it in a bit, but to be able to look at a specialty within the program once you get near the end of the program. There's also a lot of career growth and opportunities in nursing. You can become a nurse practitioner, you can get your master's, or you can get your PhD in nursing. So what can a nurse do? A little over 50% of RNs do work in the hospital setting, whether it's on a medical or surgical ward, in emergency care, the operating room, or critical care. But there's also lots of nurses who work in the community, public health, mental health, and in global health. Nurses can be in administration, so these are in leadership positions in either the hospital and the health authority in general. They can teach, they can be involved in research. And the nice thing about nursing is that you can move throughout these areas throughout your nursing career. And as I already mentioned, I wanted to highlight again, the specialty nursing that is unique to BCIT. You will get an opportunity to take some courses in a specialty that you choose later on in the program. And so some of these specialties, pediatrics and pediatric emergency and pediatric critical care. So these are all for the pediatric population, so the younger population. We have perinatal, which is caring for women who are having babies, leading up to and then immediately after giving birth. Perioperative, so in the OR. Neonatal is care of infants. And then we have critical care, emergency, high acuity. And lastly, nephrology, and that's kidney dialysis, kidney transplant, all has to do with the kidneys. Okay, and then we're fortunate to have Jana give us this testimonial. And I hope it gives you a little bit of insight into what it might be like to be a nursing student in our program. So I'll just read it out to you. It took some time for me to decide nursing was the right fit for me, but I'm so happy about my decision. Nurses make such a difference in people's lives, and I've been able to witness the difference they make firsthand throughout this pandemic. Nurses are out there saving lives, fighting this virus, and keeping us all safe. I feel really inspired to help make a difference and validated in my decision to pursue a career in nursing. My experiences in the BSN program at BCIT have prepared me to work when I graduate and to tackle unexpected challenges that will surely come my way. I feel confident that the skills and knowledge I've acquired during my time at BCIT will serve me well when I leave. So as I said, this is from Jenna Lou Cook, and she is a recent BCIT grad. So I will let admissions take over, and then I will be available at the end for you to ask some questions too.
Great. Hi, everyone. My name's Ambreen, and I'm a program advisor with BCIT's Program Advising Department. We are available to take your questions up front about the entrance requirements, about the admissions process, and sort of help guide you through what you need to get your application in and to be a competitive applicant to the program. So first off, just wanted to make sure for those that might not have seen this, we have 3 intakes a year, September, January, and April, and specific deadlines for applications. So we often get asked if there's a wait list for the nursing program. It doesn't work that way. For our program, we have a specific deadline date to get your application documents in. They will then be reviewed by admissions. And then if you meet all the academic requirements and all the preliminary requirements, your application is sent over to the program area for review, for a competitive review. So take note of the application deadlines. So in terms of the application process, it's all online. So for BCIT programs, you apply from the program website. So when you're on the BCIT website, bcit.ca, do a search for nursing, you'll pull up the nursing program website. Under entrance requirements, you will see the Apply Now blue tab, which is underneath the entrance requirements for the program. And that's where you'll be applying and scanning and attaching all your supporting documents as PDF files with your online application. There are some additional requirements that we'll talk about in a little bit more detail that also need to sort of go in before that deadline date. So in terms of the entrance requirements, we often get questions from potential high school applicants. This isn't a program you can apply to directly from high school, but we still counsel a lot of high school students in what the pathway is coming out of high school and what, you know, what courses you should be registering yourself into, what programs you should be looking into as a pathway. So we have 2 high school entrance requirements, which are pre-calculus or foundations 11 or 12, and chemistry 11, both with a B or higher. And we have some post-secondary entrance requirements for a total of 18 credits. So specifically, we're asking for an academic writing course, English 1177 at BCIT or an equivalent, 6 credits of human anatomy and physiology, which has a 3-year recency requirement. So that's the only one that really has that recency requirement. We have a 3-credit psychology, introductory psychology course, and 6 credits of general education electives. So what does that mean? We do actually have 2 PDF documents that we've provided under the entrance requirements that you should take a look at. We have an equivalency courses document where we have a bunch of different equivalencies listed for different institutions. So if you haven't taken your 6 credits of BCIT of human anatomy and physiology, you can check to see, well, what's the equivalent at Langara or Douglas or UBC or SFU or other institutions, recognized institutions. So we do have that information for you. Either if you're planning your studies at this point, or if you've already taken your courses, you can check to see if you have what you need. We also have a link, a PDF file for general education electives and the subjects that are accepted to meet the criteria for general education electives. So, and there are lots of different choices of subjects that can be applied towards this requirement. So in terms of the requirements, those, and I'm going to just say this because it came up in one of the questions, those can be taken at BCIT. But again, that adds up to 18 credits. We have in the past said, you know, it's probably better and more competitive if you have 30 credits of post-secondary studies, but we have had less competitive intakes as well. So we encourage you to apply if you meet the requirements for the program. In terms of entrance requirements, non-academic requirements, we have the mandatory applicant questionnaire that also needs to be completed, which is basically documenting your work and volunteer experience, anything that might be relevant. That might help to strengthen your application. Does not have to be healthcare related. And perhaps Jill can speak a little bit more to this later, but it's highlighting your skills with people. Could be in a teaching capacity, in a leadership capacity, documenting your life experiences. So different types of experience can be applied towards that. Casper test is an open response situational judgment test that evaluates aspects of your social intelligence and professionalism, such as ethics, empathy, problem solving, and collaboration. So that's a test that's done. There's specific dates that are listed for each intake where you can take that test. And again, it's a requirement that needs to be done for a specific intake. The admission process is competitive, and the selection committee considers your academic background along with these other factors in selecting applicants. Preference is given to those that have academic grades above the minimum. So you want to try to shoot for higher grades than just the minimum. If you have additional post-secondary credits and any kind of relevant background, that can of course be an asset to your application. So in terms of transcripts and documents, as I mentioned earlier, you will be submitting these online as PDF files. So you can scan or take a picture of your official transcript and upload it, download your digital transcript from your school and upload it. Mailing in transcripts is not something we recommend. We don't really take hard copy documents anymore. So in terms of whether the hard copy would be required, that's sort of left up to the discretion of the admissions office, but you just, at this point, you would just be sending your documents as PDF files online. So for the admissions process, the admissions officer will review your application to ensure that you've met all the requirements. That's the first step. If there's anything missing, you will be notified through your My BCIT email account, which is a little link at the top of the BCIT website that you can access. You'll be made to generate your student number and password when you're applying. The applicants who meet the criteria will, their documents be sent and their applications be sent to the nursing department for further review. And then there'll be a short list created, and then you'll have to meet a couple of requirements after that for conditionally accepted applicants. So looking at BCIT as a whole and your experience as a student at BCIT, we offer a number of different services and supports for students. We really try to view your experience at BCIT quite holistically, try to support you in a number of different ways. Students have access to counseling services, to accessibility services, to financial aid and awards. If you do want to look up information about financial aid, including entrance scholarships, if you go to bcit.ca/finaid, FINAID, that's a good place to start. You can book an appointment to see a financial aid advisor, but there's a lot of information there about student loans as well as scholarships and bursaries. So program advising is where I work, and where my colleague Maninder is here as well, joining me with the Q&A. Today, we offer a number of different services. We have telephone advising, so you can reach us through our telephone advising line with your specific questions. We have drop-in advising, both in person and virtual. And you can contact us via email as well with your specific questions. So program_advising@bcit.ca. So for instance, if you had a question about what you need to upgrade or a specific requirement, or you've taken a course somewhere and you're wondering if it's going to meet one of the requirements, you're welcome to contact us. So in terms of where you can get more information, Erin had suggested YouTube. So youtube.com/BCIT, great place to go and sort of really get insight into the program, get to see students within programs at BCIT and really get a sense of that applied training that we offer, and view videos specifically about the nursing program as well. Our Spend a Day program is a really great way to come and learn more and experience a program more closely, get some insights. So bcit.ca/spend-a-day. I'm not sure, Jill, can you speak, or Dina, are you able to speak to whether that's been set up recently for prospective students, the Spend a Day?
No, the BSN program does not participate in Spend a Day program.
Okay, there you go. So, but can it be set up like outside of that?
No, unfortunately not.
Okay, there you go. So am I wrong? Okay, so that's about it for that, and we're on to the questions, the Q&A. So if you have any specific questions, I know there have been some coming into the Q&A.
So yes, we have lots of questions coming in. I see we've been actually answering a lot of questions too. I do want to mention that this session, as you know, is recorded. That means that within about a week or two, we're going to send all of you a copy of the recording and also a copy of the slide deck that we used tonight. So if there's information that you didn't get, if there's stuff that we went over too quickly, if you just want to take a minute and review it again, you will have a copy of this. And also, of course, at all times, check out our website for the best information. Here's a good question. How high was the percentage of cutoff in your last intake for students who completed post-secondary? So all of our students have completed some post-secondary, but what was the GPA cutoff like in the last intake? Does anybody have that information? Perhaps Dina?
A competitive GPA is 3.0.
Okay, thank you. So 3.0. And that's been asked a few times here, so that's great. A number of people have been asking, so we'll say this one out loud too. Can you apply to the program while completing the prereq courses, or are final grades needed? I know I've seen this one more than once, so it's best to just say it out. Ambreen, can you answer that?
Yes, absolutely. So yes, you do need all of the post-secondary entrance requirements prior to the deadline date completed in order to be considered. In the past, if you had a midterm grade in the high school requirements, if you were refreshing the high school requirements and had a midterm grade, you could apply the midterm grade for the high school entrance requirements. Hopefully that's clear. But all of the post-secondary requirements need to be complete and in prior to the deadline.
Another question from Kamal, Ambreen, that I hope you can help out with. What would be the total cost for the program? Do we know the tuition cost?
Oh my, I don't know it off the top of my head, but I can look it up. So maybe we can come back to that one.
Let's come back to that one, yes.
And I can tell you roughly, the tuition only is approximately $22,000. On top of that, you have your equipment, textbooks, supplies, scrubs, etc., transportation costs to going to clinical sites.
Okay, great answers. So Kamal, I hope you got all that information. That was wonderful. And I see Yuki's busy answering a bunch of questions. Thank you. So perhaps there's an answer that maybe Jill or Dina could answer. After you get your bachelor's, how does that transition from the Bachelor of Science in Nursing to specialty nursing work? Are there prerequisites required, such as a certain number of work hours before someone can go into specialty? Or can you go straight into a specialization? Just so you know, we do have our info session tomorrow morning at 10 a.m. for the specialty nursing program specifically. So if you'd like to think ahead and attend that info session, the sign up is again on our website, bcit.ca/info sessions, specialty nursing 10 a.m. tomorrow. But is there anybody that on the call right now that can speak to that transition into specialty nursing?
Yeah, I can speak to that.
Yeah.
It used to be where you had to have at least 2 years of med-surg experience before applying to the specialty program. But if you are a BCIT grad and you have taken some courses in a specialty, there are times, because we are in a shortage right now, there are students that are able to get into their specialty. Usually that is funded by the health authority. Students are also able to take the course and pay on their own if they'd like, but a lot of them opt to have the health authority pay for it, and the health authority will let you know how much experience you need. But like I said, it used to be at least 2 years, but I believe that has come down a little bit as we're needing more nurses in specialty areas.
Yeah, I've heard it's actually less than that too, but I don't know the exact time. But again, tomorrow, 10 a.m., specialty nursing. You're welcome to check out our website for specialty nursing as well. Jill, once you're an RN, so once you pass the NCLEX and you're an RN, can you work in multiple provinces? I'm not from BC and curious about working both here and away. I'm assuming this person doesn't mean multiple provinces at once, because that might be a bit tricky. But are you certified to work anywhere in Canada once you pass the NCLEX?
Yes, you can work anywhere in Canada. You just need to apply to that province to be certified in that province, but you don't need to write a special exam for that province. You just they need to look at your credentials before getting certified in that province. So it's quite easy to move around Canada.
Here's a question that even I can answer. Which campus are most of the courses held? So the labs and theory courses that are in person are held at the Burnaby campus, keeping in mind though that you will be doing clinical placements around the Lower Mainland, but labs and classes are held in our brand new health sciences building on campus. We have wonderful, amazing simulation labs in our new building, so we're very excited to have students come in there. I see a lot of questions that are very specific with specific courses or specific things. I'm not going to ask those ones out loud because that doesn't apply to the group. So I'm looking for ones that might be something that numerous people would be curious about.
Hi, Erin.
Hi.
Could I maybe ask Dina to address? I see there's a number of questions regarding GPA. Dina, do you mind maybe answering that question?
A competitive GPA currently is 3.0 for BCIT. Does that answer the question? Is that?
There's also some people asking about how GPA is calculated, Dina, whether it's based just on the prereqs that we require, or if it's based on all of your courses you've done.
It is cumulative. It is not based on the prerequisites. It's on all the courses on your transcript. So your transcript will list a GPA and we use that.
Thank you.
Some questions about from high school applicants. So if you could just, it's related to what you just answered. In terms of post-secondary credits and additional education after high school over and above the post-secondary entrance requirements.
And what's the question?
The question is whether the amount of post-secondary studies that makes for a competitive applicant.
Oh, okay. Currently for the April 2023 class that we are currently selected, there were, people had up to 30 credits. 30 credits were for this intake competitive.
That's about a year's worth of post-secondary studies, including the entrance requirements.
Yes, that includes the entrance requirements, and usually that would take 1 year, correct?
Dina, how many, someone is asking how many applicants we normally get per intake. Now I realize that's different on each of our intakes. If you guys want a tip, there's more applicants for September. So if you want to go for a slightly less competitive, try April.
Yeah.
But how many people generally apply per intake, Dina?
Averaging it out, we have intakes, like you said, September's our most competitive intake. Averaging out, I would say we get 4 applicants per seat, sometimes up to 8, but averaging up to about 4.
Now, are all those ones who actually have all the prerequisites done, or all the?
Those are only the complete applicants.
Only the complete applicants.
We get a lot of frivolous applications that nursing never come to nursing. You apply to admissions, pay $90. If you don't have all the basic entrance requirements, admissions will send you a non-accept letter. Your application is never sent to nursing. So it's important you apply with a complete application.
For sure. Yeah, don't want to waste that $90 or your own time or anybody else's time. What is the program schedule like? How many courses do we take per semester? Do we have placements during the weekends? Oh,
excellent. I was just going to answer that.
Great answer. Great question.
We don't currently have placements during the weekend, but that could change. It really depends on when we get our placements from the health authority, but right now we are Monday to Friday. They could be days and evenings. The other question was, what was the start of that question? How many courses? Yeah, how many courses? It varies each term. Like in term 1, we have 5 courses. In term 2, you have 3 courses, but the students generally take their LIBS course in term 2. So it does vary each term how many courses you take, but overall the credits are around the same.
Dina, when you're talking about GPA earlier, does that include the high school GPA?
No, only your post-secondary education GPA. High school, your high school entrance requirements, you have to have the minimum mark listed, but we don't look at the GPA from high school.
And also, Dina, I know you're typing an answer while I'm asking you this. Yeah, people are a little confused on which GPA scale we're using. So is a 3.0 equivalent to a 73% or a B?
Yes, it's a 4.0 scale.
Yeah.
But I don't think people need to get too hung up on the GPA. That's a general rule. 3.0 is accredited, is a competitive. We do have applicants with lower GPA who are still successful because they have something else on their application. We look at the whole file, and sometimes you might feel you're weak in one area, but you have something another applicant doesn't have, like healthcare related work experience or really good courses or your LIBS transfer credit. So don't get too hung up on one thing. We would encourage you, if you have all the entrance requirements, to apply.
I'm seeing more questions and lots of people get answering. So I don't want to cut anything off here. We are pretty much at the end of our time, but I know people are still getting their questions answered. So I don't want to change anything. I just wanted to put up this email address again though. program_advising@bcit.ca is your best contact that we're going to give you for this session. Please do reach out to them. As we showed you earlier, they do have in-person and phone and Zoom advising, and but here's their email address. Go to our website, BCIT Program Advising. All their hours and contact information is there. They are who you want to reach out to if you're not sure about your application, if you have questions about which courses you took, whether or not they're relevant, whether they're current, if you have questions about which courses you should take to make your application more competitive, please do reach out to Program Advising. They're a great resource. I know sometimes they don't get back to you immediately. It might have a 3-day wait or something like that, different times of the year, of course, when they're busiest, but still they are your best resource. So please get in touch with them.
We do have same-day telephone advising.
Oh, same day.
And we have drop-in advising in person and virtually as well. But yes, it can be a 2 or 3-day wait for the emails. So emails can be a good way to sort of ask more specific questions. And that's why it can take time for us to respond and send very specific links and information that you need. But you do have those other channels to reach us as well.
Okay, I feel like our questions are winding down, so I'm going to start closing things up. Again, we really appreciate all of you bearing with us, being patient, persevering with trying to get into the session tonight. I'm sorry about the error with the link and not including the password in that email. I'm not sure what happened there. We'll have to look at that for our next session, make sure it doesn't happen again. But I really do appreciate you guys working through that issue with us and taking the time to come on this call tonight. I hope we gave you at least enough information to kind of get you started on your journey, get you going and get you looking at what it takes to get into nursing and to be excited about the career and the program. As Jill said many times, nursing is a great career with lots of job security and lots of different options. You don't have to just stick in one role within nursing for your entire career. There's certainly lots of areas to move around and options for continued education and continued learning. So again, thank you very much for coming tonight, and we wish you all the best of luck on your education journey. Thanks.